We hear a lot about the rural healthcare crisis. You're on the ground. Is there a crisis, number one? And can you talk us through the journey of a typical family and what that journey would look like for a family from the Riverina or Murrumbidgee to access a service with the kind of challenges that you've just outlined?
So I guess the first one's easy. Yes, of course, there is a rural healthcare crisis at the moment. And that's at all levels, particularly, primary healthcare. So at the GP level, there is an absolute crisis in the shortage of adequate GP care. So to be able to, we've heard from Jackie before, to be able to access a GP appointment can be weeks, if not months, for a non-urgent issue. Or these families are accessing bulk bill GP services where it's just not that continuity of care. So if a family comes into a bulk bill GP service in our area, and there's one particular practice that we get a lot of referrals from, they come in, they say, I've got concerns about my child. The first thing they say is, well, we'll refer you to the paediatricians. And we get a one-line referral that says, please see this child for, behavioural problem or, parental concern. Or my favourite one was, please do a cardiovascular exam, which means listen to their heart, with no indication as to why that needed to be done. So we get bombarded with referrals of all these patients, and our waiting lists are now up to 2 years long, okay, because we have a lot of problems that probably could be managed at a primary healthcare level if there was those services available. Now, because of this, and now the referrals are generally not very informative, we have difficulties then prioritising and triaging the need for those children. So they sit on a waiting list that may be up to 2 years. And like we've heard from before, if you've got a 4-year-old that's been referred to us, that's then they're well into school, 6 or 7 before we're actually seeing them at our level first, and then trying to refer them to services which don't exist. So allied health services, you can't get in to see a speech therapist for, at least a year or 2 as well, if you can even get in and afford it. There's OTs, all our private OTs at the moment actually have their books closed, so you can't even get onto a waiting list to be seen. It's a crisis at all levels.
And, OTs play such a critical role, particularly in some of these behavioural and emotional dysregulation issues as well.
Absolutely, they do. So, when we get these referrals, we send it back to the GP and the families to make recommendations to try and see if they can access NDIS early childhood early intervention funding while they're waiting, try and get into a speech therapist, try and get into an occupational therapist, but generally they're sitting waiting for years without anything being done, unfortunately. And even once they do get the NDIS funding, it still doesn't open access to therapies. So we've got plenty of kids, particularly in our surrounding towns. So Wagga, we, as Theresa alluded to, we have a large catchment area. We can go sort of 2.5 hours away in diameter around from where we are. We outreach to these communities and there is no services out there. Even if you have NDIS funding and a diagnosis already made, it's hard to access those services locally on the ground.
Absolutely. On the NDIS website for early intervention services, there's basically no rural partners, childhood partners outside that will deliver these services outside of the major rural towns. So a lot of people look to NDIS as a solution, but again, that's not reaching kids in the country.
I think we will get a therapist and they'll stay for about 6 to 12 months and it'll open up some capacity and then invariably they leave again.
And maybe, Therese, can you talk about this concept of the revolving door? We hear that a lot, that it's hard to keep, even if you can get clinicians, it's actually really hard to keep them in rural areas as well. And what might be some of the reasons for that?
I think there's a multitude of reasons, and I guess we're somewhat lucky in Wagga that we have a reasonable number of specialists, but as soon as you go half an hour out of Wagga, they struggle with GPs, and there's no further specialists than that. And allied health as well, so the therapists, very hard to get them to small towns and to retain them. The reasons stem from training, so people mostly have to do their training in larger towns, and I think once you at a certain age and stage in life, if you come to a larger town, you end up buying a house or meeting a partner, and it's very hard to leave after that. It's then hard to get people to come back. They're settled. Most people don't probably see the same glory of the country that we might. So we come to Sydney and my blood pressure goes up because the traffic's high, it takes ages to go anywhere, everything just seems hard. Whereas in the country, for us, it's life's easy. We've got a great lifestyle, but I think it's very hard to sell that to therapists or doctors. So hard to retain. And one of the things I think you rely on is your colleagues. So if there's only one occupational therapist serving a large community, then they get overburdened and burnt out very quickly, and they leave, and then there's no one. Whereas if you can just have a small number of people there, it ends up growing into a much larger number. So there's so many different factors, you know, from training to finances to numbers, that just the levels are hard to explore and then hard to work out a solution to all of this.